What if a medication you prescribe every day could quietly trigger a life-threatening autoimmune storm? In this presentation, I walk through a striking and educational case of drug-induced ANCA-associated vasculitis linked to hydralazine, a well-known antihypertensive that in rare cases can lead to devastating multi-organ disease. So, this is a 75-year-old woman with a history of hypertension and atrial fibrillation. A patient on hydralazine has been taking for a while, who initially comes in with pretty non-specific symptoms: fatigue, malaise, some weight loss, decreased appetite, nothing that immediately screams critical illness. But then things start to change. She develops a cough and then hemoptysis. Imaging shows bilateral opacities and ground glass changes. At this point, you are thinking infection, maybe something inflammatory, but then her respiratory status worsened rapidly. Now she is in respiratory distress. Chest imaging becomes concerning for diffuse alveolar hemorrhage. She ends up in the ICU, requiring high flow oxygen, and eventually we intubated her. And it doesn't stop there. Her course is complicated by a pulmonary embolism. At the same time, we start seeing signs of kidney involvement. Now we are looking at a possible pulmonary renal syndrome, which really shifts the differentials. Then the lefts come back. She came positive for MPO-ANCA. She also has elevated antihistone antibodies. Complement levels were normal. This combination starts to raise a big question: could this be drug-induced? A kidney biopsy was done, and it confirms pauci-immune necrotizing glomerulonephritis with crescents. At this point, everything comes together: hydralazine-induced ANCA-associated vasculitis. And while we know hydralazine can cause autoimmune issues, this kind of severe multi-system vasculitis is rare, but when it happens, it's very aggressive. Treatment had to be immediate and intensive, so we stopped hydralazine right away, started high-dose steroid, and escalated to rituximab, cyclophosphamide, and plasma exchange, along with full supportive ICU care. So, to conclude, what makes this case so important and honestly a little unsettling is how it started. Nothing dramatic, just fatigue and vague symptoms, and within a short period of time, it progressed into a life-threatening condition involving the lungs and kidneys. The takeaway here is simple but critical. When you see multi-system disease, as well as positive autoimmune markers, especially in a patient on medication like hydralazine, always keep it as a differential. Always consider a drug-induced cause or drug-induced etiology, because catching it early can completely change the outcome. In this video, I break down the full case, the clinical reasoning, and the key learning points from this experience. I'm so curious to hear how others would approach this. Feel free to share your thoughts or similar cases in the comment section.